Is it working? Yes,
Yes.
perfect.
Okay.
Amazing. Hello, Dr. Noury Adel. We are so glad to be live with you tonight. We had a few technical problems, but we made it.
Yes, it's from my side. I'm very sorry for the inconvenience. And we are streaming through my own Facebook page, but Hannah is the host, so feel free, Hannah.
Yeah, it's basically an initiative of Softfil and Softfil Academy. We really wanted to have the insight of Dr. Noury Adel on his use of cannulas, on his practice of aesthetic medicine in Egypt. So it's going to be a short interview on his practice. And
Yes.
maybe I'm gonna dig in and start with the first question that we have for you. We would like to, if you can tell us a little bit about yourself and how you specialize in oral and maxillofacial surgery.
Okay, so first of all, my name is Dr. Noury Adel, as Hannah said. When I finished dental school, I had this passion about surgery. So I decided to do my master degree in oral maxillofacial surgery. And you know what, Hannah? Back at the dental school, we didn't know that much about facial aesthetics. Despite there is a lot of correlation between dentistry and plastic surgery and oral maxillofacial surgery. So I attended this course here in Egypt about neurotoxins and fillers. And you know, I felt it. It was like, wow, I can like do those major changes. I can make people happy about themselves. So I felt this is the thing that I want to do. And this was like 8 years ago or something.
All right.
Then I took the course. My first patient was my mother. I treated her nasolabial fold with fillers. And you know what? Back then, they didn't teach us that much about complications. So everyone was working with needles, and if I knew back then how much would a filler in the nasolabial fold make a complication such as necrosis or blindness if the needle got intraluminal with your filler product in the vessel, I wouldn't have the courage to work on my mother. So that is the number one thing when it comes with cannulas, and especially Softfil cannula. The cannula incidence to puncture a blood vessel or to cannulate a blood vessel is dramatically less than needle, and it all depends on the gauge. That's why my preferred cannula regarding the Softfil, I like the 22 gauge cannula. It's my favorite. 25 gauge is like the Joker. You can use it all over the face. It's like I have a global action. But I tend to prefer the 22 gauge because the less incidence of vessel cannulation with the 22 gauge cannula.
Great. We're so thrilled that you are familiar with our cannulas, using cannulas in general, but in particular using Softfil cannulas. Can you tell us when did you start using cannulas and Softfil cannulas?
Okay, so I've been practicing for 8 years, but I've started using cannula for like 4 years. Right. And as I told you, because when I was first taught about this specialty, we were not taught how much complications do happen. We were just fancying about poking with needles, creating a beautiful cheek contour, beautiful lips. But I guess nowadays, because of this, like so much complications that we do see on the Instagram, on the Facebook, the posts of patients or have, we should always be aesthetic outcome, but we always want to do a safe injection. So this is why I've always seek to use the Softfil cannula. And by the way, I knew the Softfil cannula from Dr. Steven Weiner. I'm a huge fan of his work, yeah. And I had the pleasure also to interview him in a webinar on my Facebook page. We talked about the duplex ultrasound. One more tool, Hannah, that any injectors should learn about it and include it in his facial aesthetic practice, cannula and duplex ultrasound, to provide an injection with a safe protocol.
It's amazing you're speaking about it because Dr. Weiner, we are very close with him. He's an expert of Softfil Academy as well. And he is going to give a lecture soon at 𝗵𝗃 about ultrasound and cannula technique.
Yes.
Yeah.
One more thing, Hannah. Using ultrasound is not just to provide a filler-guided injection with the ultrasound. You can use the ultrasound also to dissolve fillers by using a less product of hyalase. Hyalase, it is an 𝗪𝗪𝗪𝗪 enzyme. It is used to dissolve fillers out of hyaluronic acid for everyone who is watching us who may be a novice injector. So ultrasound is very, very beautiful tool that you can use it to guide yourself during the injection or to solve problems that happens out of filler injection. And cannula, it can be always used as an adjunct in both ways, for treatment and for dissolving. You know, I always use the 27 gauge cannula when I want to dissolve a filler, especially at the ergotrade area. I do see a lot of patients who do a lip filler. Maybe they were injected with not appropriate technique, and you see the filler escaping through the skin side of the lip and accumulates in this area, creating a ledge or a mustache appearance. I poke the skin with my pilot needle that comes with a Softfil cannula, and I enter with the cannula to dissolve the filler in this area. A 27 gauge cannula works perfect for this purpose.
Amazing. It's very interesting what you're telling me. And I want to tell you that I don't know if you've heard about the product. It is not released in the Middle East or in Egypt yet, but we just released a new product that is a topical hyaluronidase.
Yeah, I saw the video. It was amazing. They applied it on the cheek.
Right.
But it works superficially or it penetrate deep into the tissue layers?
No, it works superficially. It is not a replacement for injectable hyaluronidase. It's really more of a superficial, like to adjust your results type of product.
Yes, perfect. But I guess it works fine for small lumps and bumps that you wanna like do a molding for it instead of dissolving the whole filler. Because you see, hyalase doesn't differentiate between the normal hyaluronic acid in your body and the native and the foreign one that comes from the filler. It just dissolves both. But I guess Topilase is gonna be perfect to work on small minor deformities.
It's exactly what it was created for. You know, this type of moment that you don't really need an injection of hyaluronidase because it's too small a defect, but you just want to adjust a little bit and go superficially, but make your results perfect.
Yes, perfect.
We're
Unfortunately,
excited.
we don't have it here in Egypt yet.
Yes, we hope that it will arrive soon. We'll let you know.
Hopefully.
So, can you tell us for which procedure do you prefer using the needle and for which procedure do you prefer using the cannula?
Okay, perfect. So there was a time where I would always stick to needles when treating the lips or treating the midline of the chin or the angle of the mandible. But nowadays, I've started to do some practices to modify my techniques. So I'm always like 99% cannula user. I use it in the lips. I use it in the chin. May I demonstrate on myself?
Sorry?
May I make a demonstration on myself?
Of course, that would be great.
Okay, perfect. So I have here the Softfil Easy Guide, this beautiful butterfly appearance. So I can make the poke right at the midline of the chin. And then I'm gonna enter with my cannula. And I like this red dot because it shows you where you're opening when you slide the cannula underneath the tissue. And I can enter the midline and do my injection and go laterally to give this overall V-shaped or to fill on this lateral sides. So nowadays I don't need actually to use the needle. And I'm gonna share a secret with you, Hannah. After I started to use those techniques, I still had a problem with the lips. Cannula is great for the lips, but it gives just a subtle and natural improvement. It doesn't draw this V shape. It doesn't play with the Cupid's bow, the lip tubercles. So I did a paper using a filler and your cannula, and it got accepted, but I'm not allowed to speak about any details yet. It's going to be published hopefully next month with a new technique of lip filler. I guess with this technique, I will be able to redraw the lips using the cannula.
Amazing.
By modifying the technique, yes. But I'm not allowed to speak about it. I have took their permission from the journal, but they told me once it got published, they can speak about this technique.
That's great. So we'll speak again soon.
Yes.
Amazing. So you've shown us a little bit the easy guides. I know that you are using it quite a bit because we saw your videos, but can you tell us how it changed your injection protocol? What do you think? Why do you use the Softfil easy guides?
Okay. First of all, I had a very bad Am I allowed to speak about other brands?
Sure.
Okay. Okay, we are not gossiping, we are spreading knowledge. So I had a bad experience with the Korean cannulas, actually. It was the worst types that I have ever used. The Softfil cannula, when you look at it, you see it's flexible. It doesn't bend. And I give a lot of courses and trainings here in Egypt, Hannah. And you know, fresh injectors, they don't have this sense when they start working with the cannulas or needle. So you can see that cannulas bend, but look at the Softfil. I'm always bending it like the full length and nothing happens.
Yeah.
One more thing, the internal diameter is larger than the external diameter, so it gives a more precision during the injection. And as